Yo, 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 what's up, my dudes, dudettes, and dental fanatics? Welcome back to Gums and Giggles. It's your boy Preston, and I'm here with my co-host.
Hi, Prince. It's Jules, and today we're diving deep into a disease that's got some serious street cred in the respiratory world. Chronic obstructive pulmonary disease, or as the cool kids, aka the doctors, call it, COPD, COPD.
Yeah, bro, this one's a real skibbity toilet of a disease. Like, once you get it, it ain't flushing away that easily. But don't worry, we got you covered with the deets on what it is, where it came from, and how it messes with your lungs and your grill. So buckle up and let's get this party started.
All right, let's talk about how this menace even starts. COPD is basically lung beef. Your lungs get into a toxic relationship with smoking, air pollution, or even bad genetics, and boom, inflammation, mucus overload, and straight up suffocation vibes.
It's got stages too. Starts slow like that one guy in the gym who does one set and then scrolls on TikTok for like 20 minutes. First, there's inflammation in the small airways, then the lungs lose their chill. And next thing you know, you're wheezing like a grandpa trying to sprint after the ice cream truck.
And the wildest part, it can start when you're a kid if you're around hella pollution. Even if you stop smoking, the disease can keep progressing. It's like your lungs are that one friend who just keeps bringing up trauma from 3 years ago. Like, just let it go, bro.
COPD has been a thing for centuries, dude. Back in the day, they just called it chronic bronchitis or emphysema. First real description, some medical homie named William Briscoe dropped the term COPD at a conference in 1965. Legendary move.
But let's be real. People were hacking up lungs way before that. They just didn't know it had a name. Once docs figured out what it was, they started looking for ways to diagnose and treat it. Cue the invention of the spirometry, aka the breathalyzer's nerdy cousin.
All right, so how do you know if you got COPD? Let's break it down. First one is shortness of breath. Like you walk up a flight of stairs and your lungs are already tapping out. 2, we got chronic cough. We're talking that deep, guttural, someone get this dude a glass of water type of cough. 3, we got a mucus party in your airways. And the VIP guess, phlegm and inflammation. 4, we got wheezing. Not the cute kind like when your dog snores, but the kind that makes your people ask if you're okay type wheeze.
And don't forget those nasty flare-ups, aka exacerbations. Basically, your lungs go hard pass and make breathing even harder. Triggers, cold air, pollution, strong smells, or that one cologne your uncle wears that could knock out a horse.
So, can you cure COPD? Nah, bro, it's here for the long haul, but you can treat it. First rule COPD club, stop smoking, like immediately. Do not pass go, do not collect 200.
Then you've got meds, bronchodilators to open up those airways, steroids to calm the inflammation, and if things get real bad, oxygen therapy to keep you breathing like a functioning human.
And for the hardcore cases, surgery or lung transplants. But that's like pulling the emergency brake on a train. You do not want to get to that point if you can help it.
Okay, real talk. COPD is more than just a breathing problem. It's a life problem. Walking, talking, laughing, even just brushing your teeth can feel like it's running a marathon.
It also messes with your mental game. Imagine constantly feeling like you can't get enough air. That's straight up panic attack fuel. A lot of people with COPD struggle with anxiety and depression, which honestly makes a total sense.
Okay. Plus, let's not forget about the guilt. If smoking caused it, people can feel hella bad about their past choices. But we listen and we don't judge. It's all about moving forward and managing it.
All right, my fellow hygienists, listen up because COPD patients need special care in the dental chair.
First off, they can't be lying back like they're in some beach chair, just chilling. Their lungs hate that. So we gotta keep them more upright. And also don't forget, you cannot use the Cavitron because those aerosols give mad respiratory distress.
Also, stress reduction is key. No one wants a panicked, breathless patient mid-prophy. And if they're on oxygen, you might need to adjust how long they can tolerate that treatment.
And here's the kicker. Bad oral health can make COPD worse. Yeah, bacteria from gum disease can slide up into the lungs and cause infections. So if you've got a COPD patient, you best believe we're throwing down some hardcore oral hygiene education.
All right, squad, that's the T on COPD. We covered its origin story, its symptoms, its treatment, and why keeping your mouth clean actually helps your lungs. Who knew, right?
Moral of the story, like Wu-Tang says, protect your neck, protect your lungs, protect your mouth, and if you ever hear someone wheezing in a way that's not normal, tell them to go get checked out.
And with that, we're out of here. Don't forget to like, follow, and floss. This has been Gums and Giggles, and we'll catch you next time. Stay fresh, stay flossy, and don't let your lungs take an L. Peace.
Later, skaters.